What if I told you the biggest medical scam in America is finally falling apart? Tremendous things are happening in the fight against circumcision, male genital mutilation, and if you're a male, it's a war against you and your bodily autonomy, and I'm here to break it down for you. With facts and reasons and logic, or maybe a joke or two, but I'm not promising. So RFK Jr. just said circumcision isn't harmless. Finally, a politician who's anti-cutting something that isn't a budget. At the Health Equality Campaign, we've been pushing that truth for the last few years, and now it's national news. And maybe, just maybe, America's ready to admit you don't make a healthy baby better by amputating part of him. I'm going to cover what's happened with that and who instigated it. And a brand new study, ironically from our opponents themselves, that shows circumcision rates in America have dropped to 49.3%. That means intact babies are now in the majority, and circumcised male infants are now in the minority. That drop was almost right in line to the year with the prediction Intaction made years ago. So give us a pat on the back for that. And that's not all. For the first time in history, Intaction and the Health Equality Campaign are taking the fight for your bodily autonomy directly into the halls of power in Washington, D.C. And I don't mean protests or signs, but real advocacy where the laws and regulations are made inside. And we're breaking new ground for the male bodily autonomy movement, and it's happening right now. And I'm going to tell you how you can be involved at this critical moment in time. So let's get into it. You know, things are changing in America when even RFK Jr. says circumcision might be a bad idea. Yeah, the Secretary of Health and Human Services just went anti-circumcision. Finally, someone in D.C. said it. Maybe cutting parts off of babies who didn't consent, that isn't healthcare. So yeah, that RFK Jr., he said something we're all going to be on board with. But not to mention he supports getting toxins and crap out of our food and to practice fitness before medicine. He's out there talking about circumcision. And okay, he sprinkled in a little autism stuff. The man never met a cause he couldn't link to another cause. But circumcised males do have higher rates of autism. I know correlation is not causation, but correlation does make you wonder. But let's not miss the real headline here. The Secretary of Health and Human Services just trashed infant circumcision. That's like the Pope advocating for eating meat during Lent. So let that sink in. A Kennedy in a suit on camera at a cabinet meeting questioning America's most awkward ritual since the electric slide. Now, I'm sure some of the details are open for debate and further research. I mean, he's still RFK Jr. He's not a medical scientist, even though the medical experts don't have a monopoly on common sense, and sometimes they even lack it. But the point is, someone in Washington finally said what every sane person's been thinking. Why do we cut infant boys' genitals? And here's the interesting part. The reason he's even talking about it, that's because of us. The Health Equality Campaign. Yeah, we've been lobbying him and HHS. We sent the policy papers. We said, hey, if you're going to preach about medical freedom, maybe start with the one surgery that violates it before a person can even say goo-goo. And you know what? He listened. Maybe a little too enthusiastically, but hey, we'll take it. Because here's the truth. For decades, circumcision's been the third rail of medicine. You can talk about vaccines, opioids, abortion, hell, even alien DNA. But bring up circumcision and suddenly everyone's staring at the floor like, wow, look at that interesting carpet pattern. Doctors don't want to touch it. Hospitals love the billing code, and parents just assume it's the normal thing to do. Well, you know what else used to be normal? Smoking while pregnant and letting kids ride in the back of pickup trucks. The fact that RFK Jr. is even criticizing circumcision at all, that's huge. That's the first real crack in the wall of silence around this issue. And yeah, the Health Equality Campaign helped swing the hammer. We've been in those offices reminding them that circumcision isn't health care. It's a superstitious religious practice dressed up in medical mumbo-jumbo designed to cut men down to size in every sense. You don't get to say you love freedom and then look the other way while hospitals strap down babies and slice off part of their dick for tradition. So, sure, he might have gone a little off script, but let's give him credit. The man just made circumcision fair game for national debate. And that's exactly what the health quality campaign's been fighting for. Not silence, not superstition, but an honest, grown-up conversation about a practice that belongs in a medical museum, not a maternity ward. So thank you, Mr. Secretary. You've charted the course, and you finally said what everyone else has been too scared to whisper. Maybe babies deserve the same bodily autonomy adults do. Now, if only the rest of Washington would grow a pair and stop paying hospitals to cut foreskins off because they're too afraid of offending someone, because bodily autonomy starts at birth. So after the RFK thing happened, I received a few comments from people who claim to be activists. They're probably just keyboard warriors, saying things like, how could you work with RFK? His position on vaccines will harm the movement. Or he's totally wrong on autism. Or he's MAGA and Trump, or some other nonsense. Here's the deal. He's the Secretary of Health and Human Services, and he's in charge, so we have to work with him. Plus, he's a disruptor of the status quo and unafraid to challenge sacred cows. And he's from an iconic family in American history. The man trashed circumcision during a presidential cabinet meeting, and he got the sitting U.S. president to agree with him. And that got massive news coverage, with the practice of circumcision placed on the defensive. So what I tell these people, these keyboard warriors, is get off your high horse and accept the win. In politics or public policy, you may have to work with people you may not agree with all the time. If it advances your agenda, that's what you do. It's about making progress and moving forward towards your goal. That's being a real activist. I don't care if it's Donald Trump or Gavin Newsom or AOC. If they want to work with us, I want to work with them. And the cause comes first, not your politics. I want to say thank you and give a shout out to some people. I've got Jack from Illinois. I've got Chris from Oregon. I've got Jonathan from Arkansas. I've got Everett from California. I've got Dan from Colorado, just to name a few people. I appreciate it. I'm a volunteer too. I volunteer all of my time. I don't get paid 1 cent to do this. In fact, I'm a donor. So your moral and financial support, it's greatly appreciated. I also want to take a moment to mention the passing of a friend and fellow activist, Sean MAHA. Sean was deeply committed to the cause of protecting male bodily autonomy, and he was a proud supporter of Intaction and a member of Intaction. His dedication went far beyond words. I mean, he even included Intaction in his will, ensuring that our work and advocacy can carry on into the future. Sean's passion and generosity will not be forgotten. Moving ahead, I want to talk about the recent study from Johns Hopkins, which found that circumcision rates in America have dropped to 49.3% as of 2022. That means intact babies are now in the majority, and that's nearly a 10% drop since 2010. If you recall back then, the National Hospital Discharge Survey pegged nationwide circumcision rates at 58.3%. We said this was going to happen 10 years ago, back in 2015, where we charted circumcision rates and we publicly predicted it would hit 50% by 2020. Of course, people didn't believe us at the time. They claimed, with little basis, that rates were higher. But Hopkins just found that it hit 49% as of 2022, and I think that's pretty damn close. And remember, healthcare statistics are always a lagging indicator, so the real rates are likely even lower. The point of this is to say the tide has turned. And the researchers from Johns Hopkins were astonished that rates dropped even after the so-called experts at the American Academy of Pediatrics, they tried to prop up the practice with their muddled 2012 statement. It was half endorsement and half dodge. You know, the one where they said the benefits outweighed the risks, but they couldn't state or quantify what the risks were, and then they just threw it to parents to let them decide. It was a policy statement without guidance because parents aren't medical experts. But in the end, the AAP con job, it just didn't work. But let's be real, you can't polish a turd and call it a policy statement. Parents saw right through this con. But actually, in the end, it doesn't matter what the actual rate is. Healthcare statistics, they're always open to interpretation. What's important is that it's indisputable the trend is down, down, down. So if you're wondering what I've been up to recently, I saw that there are opportunities in Washington, D.C. for creating change and I felt like we had to be there. We're in the midst of an extremely disruptive administration, and combined with RFK Jr.'s MAHA movement, it created a perfect storm of change for us. In my view, it would be negligent for me to call myself an activist and not be in DC and lobbying at this point in time. We hired people to represent us in DC with a focus on healthcare policy. They have the relationships and connections with people very high up in the current administration, at the very top, and they can get our proposals in the hands of the right people. Now, we got off to a running start back in June where we directed our proposals to key legislators during the drafting and debate over the big, beautiful bill. The Republicans were trying to maintain tax cuts, and to do that, they needed government program cuts to pay for it. So that gave us an opportunity to pitch about $250 million in savings by stopping Medicaid circumcisions in the 33 states still paying for them. We then began meeting and pitching congressmen and senators from states that didn't cover Medicaid circumcision. There's 17 of them, because their constituents were paying taxes essentially for a service that wasn't available to them. And they became interested in that angle. So I can't get into the details about who we spoke to or whose desks our proposals have landed on, but we've communicated with and pitched some of the very top people in the administration and on the Hill. Top people. Our main proposal is what we call our one-pager about why HHS needs to stop providing funding for Medicaid circumcision and why that's in the public interest. This is where we need to be. In over 50 years of the modern intactivist movement, we are the first ever organization to lobby inside the U.S. Capitol with paid lobbyists. Now, whenever any federal or national issue comes up that is of concern to our movement, I can inform our reps and they can go on the Hill and pursue it. There are some in the movement that say, well, even if we are successful, it's still not a perfect solution because hospitals or managed care insurance companies will find a way to work around it. So they use that as an excuse not to do anything. Doing nothing and hoping for some future change is not a strategy. I can guarantee if we're not there, if we don't show up, we're not going to get anything. And my observation after being on the Hill over the summer is that everyone is there. Every special interest, every advocacy group, they're getting attention for their issue. But for 170 million men in America, I'm the only one fighting for their bodily autonomy. Lobbying does take time, and sometimes you're in a holding pattern until the right opportunity comes up or a piece of legislation is available to which we can attach ours to. But whether it was the big, beautiful bill or the rescissions cuts or a government shutdown over spending, our lobbyist is right there offering our solution to the budget problem to the right people. Politico is reporting that the GOP is looking at year-end health care revamping as they sort through budget-saving changes to the Affordable Care Act. And I want our lobbyists whispering in their ear that we can save them $250 million. Do they want to use the federal budget money to keep ACA expansion, which voters love, or do they want to blow it on cutting baby dicks? The real challenge in lobbying for us at the federal level is to get the money we need to continue. We've been at it for 5 months, and how much longer our work can continue it's not known because it's very costly what we pay for monthly retainer fees. But when you spend thousands but get a health secretary publicly bashing circumcision on TV,
children who are circumcised early have double the rate of autism,
and the president agreeing with him, that's priceless. So here's the bottom line. For decades, this fight's been stuck in the trenches with pamphlets, protests, and debates in the comments section. And don't get me wrong, all of that matters. But now we've taken the issue directly into the halls of Congress, the agencies that write the rules, and to the policymakers who control billions of dollars in healthcare spending. And that's where the future of the struggle will be decided, not on Twitter and not on a sidewalk. And here's the kicker. We're the first and only organization in history to do this. Think about that. 50 years of intactivist work, and it's the Health Equality Campaign and Intaction that finally put shoes on the marble floors of the Capitol. We're in the room, we're pitching the solutions, and we're disrupting decades of silence. But if we're not there, if we don't show up, guess what? the other side wins by default, and the status quo remains. Now, lobbying isn't glamorous. It's not viral memes or flashy stunts. It's long hours, policy binders, and frankly, expensive access. But it works. It's part of how most change in this country actually happens. You can either yell from the outside or you could pull up a chair at the table where the deals are made. I choose the table. And this is where you come in. Because this campaign doesn't run on wishful thinking. It runs on real support from real people who care about bodily autonomy, who care about human rights, and who care about giving guys a choice over what body parts they get to keep, because you didn't have a choice. So if you ever thought, yeah, someone should do something about that, congratulations, you found the someone. It's you. It's this movement. Click the link and chip in whatever you can. $10, $25, $100, or more if you're able to. Every dollar fuels the fight. Every donation keeps us in Washington. It keeps us lobbying, and it keeps us disrupting the status quo. We can make history, and not in 20 years, not in some distant future, but now. This is the health equality campaign. This is the fight for real choice. And together, we're not just imagining a different future, we're building it inside the U.S. Capitol. So join, act, and donate. See the links in the description on how to do that. And if you join, I'm going to send you this cool member gift box. Because if we don't work on this, who will?